Hi, everyone. Thanks for joining us today. My name is Susan Cornell, and I am the Associate Director of Experiential Education and a Professor of Pharmacy Practice at Midwestern University College of Pharmacy in Downers Grove, Illinois. I'm also an alumnus of the College of Pharmacy, graduating a long time ago, and my specialty is diabetes practice. I've been practicing as a certified diabetes care and education specialist for over 25 years. I am joined by two esteemed colleagues. I have Dr. Sara Giaimo, who is an alumnus of Midwestern University College of Pharmacy in Downers Grove, and she's also had quite the career path. So going from community pharmacy to an industry or pharmaceutical care, or pharmaceutical industry, pharmacist, I should say. So very exciting career path, and actively involved today with Midwestern. She continues to be involved in community service events and alumni events. Also joining me is Kyshonna Dunn, who just finished her first year of pharmacy school, so congratulations. And now she's entering her second year, so 1 down, 2 to go, and it's probably been quite a hectic pace. Yeah. So thank you for taking time from your rotations and your summer studies to come and talk with us.
It's my pleasure.
Yeah. So let's jump into this. So research, a lot of people look at research and they think, making products. But research encompasses just so much. And Dr. Giaimo, I know you've done some postgraduate training in research. So can you share a little bit about that with us?
No, sure. So after I had graduated Midwestern University, I had an opportunity to work for a pharmaceutical company called GSK. And one thing that I really wanted to strive to understand is what's the value proposition of these medications? What is the budget impact model of these medications? And how can we understand the evidence and the research so that we can better articulate that to our clinicians? So I had an opportunity to go through the University of Washington's Health Outcomes and Research Certificate program that really focuses on understanding that research from that economic benefit and then taking that, understanding it, and then articulating it back. So that was one of the ways that I was involved in research as of my postgraduate training, post-Midwestern. And then from that, I was able to go into a medical science liaison role where I actually had an opportunity to work with sites clinically. So sites that were conducting our studies, whether it was phase 1, phase 2, all the way to phase 4, having that opportunity to work with the investigators, answer their scientific questions, making sure that they had the right people in their inclusion criteria, was all a part of the way that I utilized research in my career.
And I think probably some of the coursework that we have here at Midwestern in the Pharm.D program, so in the Doctor of Pharmacy program, it really helps to prepare you for these opportunities post-graduation.
Yes, definitely. And even a part of that is I did an internship at the time with a PBM, and I was able to actually do my own research for creating a framework for their insured members. So the evidence that I was able to garner for this framework was from the studying, at Midwestern throughout my coursework and understanding where to look. There was a wonderful class that was done by Dr. Mary Lee, who is phenomenal. Actually has a book chapter that she had written. And she had given us a really great way of understanding the evidence, but how to search for it, and then how to put that all together when it comes to writing a paper or changing a guideline or looking at a recommendation.
Yeah. And today, I know there's other professors that are currently teaching the research and evidence-based medicine courses. And Kyshonna, I believe you just finished taking one of those courses.
So we had Dr. Phillips teach our class. So it was about statistics and just learning how to do journal clubs and taking the information from this clinical study and figuring out what's important about this and how do we apply it to today's medicine for the patients. And I finished that course in May. It's June now, and I'm already applying it in my IPPs.
Yeah, no, you're spot on about that because the rotations are what helped me be prepared. So having these wonderful sites and having the opportunity to do those journal clubs and, case presentations and really work with those preceptors on how to read evidence, how to make sure that this was quality data so that they could put it into their formulary was critical. I mean, it was so important, and I'm so glad I had the opportunity to do that here too.
Yes. Yeah, so it's interesting that here you have a course, and then 1 month later you're taking that information from that course and actually applying it. And you're talking more about drug trials, clinical drug trials, which of course everybody thinks of. But when we say research also is maybe a softer side to it. And very commonly we have a lot of faculty who will do research on team-based care.
Yes.
So what is the pharmacist's role within the team? What are pharmacy students' perceptions of doing a journal club? So there are different opportunities for research while you're in school as well as while you're out of school that, pharmacists are actually involved in. And so I know, Kyshonna, you and I were chatting about the fact that you were just talking about this yesterday, pharmacist in the role of the team. And so can you share more about that?
So one of the assignments that we were supposed to do yesterday was watch resident students give their presentations on the different research that they've done during their residency. And one of the doctors presented something about diabetes trials and why having a pharmacist on the care team was brought the A1C values down much more than just having a physician come in to see it. And just looking at the values and understanding that since I'm in pharmacy school, how my role in the patient care process is important and imperative, and how just our country is changing and bringing pharmacists into the care. It's different from what I would have thought before I started pharmacy school, because you just see a pharmacist and you're like, oh, they're at community, and you don't really know how involved they are in your everyday medicine. So.
And that is something, I think the perception, the image of a pharmacist for the public is very different than the reality of it, which is part of the reason we're having this conversation, because the more we educate people about what pharmacists do, the better informed they are at approaching a pharmacist or finding a pharmacist to get the answers and then being part of that team. So kind of going off of that, from when you entered pharmacy school, for both of you, what changed as you progressed through school in terms of your perception of the role of a pharmacist?
For me, what really changed is what opportunities lie outside of what your traditional thought of what a pharmacist should, can, and want to do. It is so much more than that. And there's so many facets to it. It's the avenue of going into research. It's the avenue of working for the FDA. It's the avenue of, working in pharmaceutical industry, working as that medical liaison. It's the opportunity to do nuclear medicine. It's the opportunity to be in a lab. You have the world open to you. And what I so appreciate about pharmacy is just there's so much you can do with it. And I didn't know that going in, but once I came to Midwestern, I had this exposure that I never saw, because there were so many alumni that I had an opportunity to speak with, so many of the professors, and I just felt like, here's what I can do. I can take on, and almost every opportunity was open to me, but I was willing to try and look for it. And I think that's where I want, if you are considering coming into pharmacy, really look at what you can become through this experience, through this journey, and how pharmacy has changed. And to your point, the pharmacists being a part of the healthcare team, they always were. But now what I'm seeing is they are front and center, because they are the ones, they are the decision maker. They sit on the guideline recommendations. They are the ones that are getting everybody to the table to look at what we can do and accomplish in the community and beyond.
And, Dr. Giaimo, you and I have had similar paths in the sense that post graduation, we went into community practice. And
Definitely.
with the, thought process, I'm going to be here forever. Of course, life happens whenever we make plans.
That's true.
And, opportunities present themselves. And I think recognizing those opportunities and saying, hey, there's more out there. I can do this. Yeah. So how about you, Kyshonna? I know you've only been here for a year, but what's changed in that year?
Just coming in, because our year starts in June, I think we were initially introduced to APHA.
American Pharmacists Association.
Yes, and at the Ice Cream Social, and being there, APHA is a huge umbrella. And then under there, it's the different projects that you have. So you have the opportunity to volunteer, to do like the diabetes screenings and blood pressure. There's different patient care projects, the Operation Women's Health, which is what I'm a chair-elect on, Operation Heart, diabetes, substance abuse. And that was the initial, like, okay, there is more than just the clinical or the community pharmacist. And a class that we ended, it was a lecture that we ended in professional development, where they gave us a packet, and it was like pages of things that I can do with my pharmacy degree. And I was like, oh my God, I did not know that I can work for the FDA or the CDC.
Or veterinary medicine.
Yeah, I did not know.
Or L'Oreal Cosmetics.
Or L'Oreal. No, yes.
Or NASA.
Yeah.
So plenty of opportunities.
And just even applying myself, I don't want to close any doors on myself. I don't know what I'm interested in until I try it. So I joined a lot of different organizations just to dip my toe in just the pond of pharmacy. Infectious disease is a club that one of the P3s now just made, and just looking at that and applying that to the classes that we're taking. It's just much more vast than I thought it would be.
Yeah. So it sounds like a lot of the extracurricular activities within school have actually given you additional support and knowledge. I would ask, so what is something over the past year that you found gave you the most support, or the most, and I don't want to use the word encouragement, but something where you're like, aha, I want to do more of that?
I would say it is one of the, organizations that I am is the clinical CPNP. Sorry, I'm like
the psychiatric and
neurology pharmacies. And knowing that that's like substance abuse and mental health disorders, and I'm so passionate about just coming from like the west side of Chicago, where it's so much of that. And I didn't know that I would even be able to do that. So just diving into that and being able to be hands-on and participating in like the Morning Star mission that we have every other month, where we go into a hospital and work with actual patients and people to apply the knowledge that we learned in pharmacy school. So I know that there is an organization for anything that you want to do. If there isn't, you can make it, because I know it's a couple of people who just jump-started one for like the upcoming year for the P1s that's coming in. And the support that you have here when you have the vision to want to do something, that the faculty and the professors back you up on that.
And I do believe that's so true, is really the support from Midwestern University in general. The College of Pharmacy in Downers Grove, we have a great faculty. I'm biased, of course, but it is very much, they're engaged in making you successful. They're passionate about having successful students, which you don't always see that in some places. Here, I do believe it is very different, and the support to the students really allows them to grow. And in your words, Dr. Giaimo, to become the better version of yourself. Yes. So,
100%.
Yeah.
It truly is.
So kind of in wrapping up, again, people listening and watching, what is like some imparting words that you want to share with them that you feel are very valuable? So Dr. Giaimo, I'll start with you.
If I can quote, this is from Jim Rohn, and it is, work harder on yourself than you do at your job. So why that's important is because you yourself are an investment. And when you come to Midwestern, when you become a pharmacist, you're investing in your future and in yourself and the lives of those that you serve. So that's just where I want you to think about if this is the career for you, like where the opportunity lies. And the fact that Kyshonna said, if you have the vision and you execute on the vision, it comes to life and you have the support around you to do it. So don't ever lose that vision and don't ever lose that inspiration or that power that you have to create and really change the lives of so many that we serve. So that's my imparting words.
I would say, I don't know. If you do have the passion to help people, and the drive to know that you want to just be in the medical field and being like on the forefront of helping people, like, and saving their lives with medicine, Midwestern is the place to come to. There's the untraditional classes that you may take, the cannabis electives, and just the support and the cohort that we have here is impeccable. And I know that I wouldn't be in my second year without the professors that I've had. Even the people in the cafeteria just are friendly and smiling all the time. Unbiased. Yeah.
Great. All right. So, of course, we have to have some fun. So, leisure time is very important, too. We talk a little bit, and we've talked in the past about balance and mindfulness. So, what's your favorite music or your favorite genre of books to read?
Oh my gosh. So lately I've been really focused on leadership books, and I can't get away. As you know, it's part of everything I do. Yeah. But just even having the opportunity to read. But one thing, like from a leisure time that I enjoy so much is I'm very involved in my church, and I teach Sunday school to 9th and 10th graders. So kind of that, starting teenage years or kind of in the middle of it. So it produces challenges, but I also look at it as opportunities for me to help support these younger individuals in that time of their life by teaching them, how to be a better version of themselves. So that's what I really enjoy, and I'm very involved in my church. So.
Yeah, wow, good for you. That sounds amazing. Yes. How about you, Kyshonna?
I would say the music I listen to is 100% Drake. I love him. And my favorite genre of books is dystopian. I've read just about every book there is. And a fave is always going to be Hunger Games. But yeah.
That sounds fun. Yeah, for me, I love jazz. I really do love jazz. John Coltrane and, Herb Albert, and I can go on and on. Many, many names. But the other thing, too, is I love mystery novels.
Yes.
And I love a character that continues, where it's not one book, you're done. It's a continuation of the character and the growth of the character and the support, So again, it's always that support team, but it's my relaxing pastime. Yeah. So, well, thank you both for joining us today. Truly appreciate it. And we hope folks took away some valuable information. If you'd like more information about the College of Pharmacy at Midwestern University, please visit our website. Thank you for your time and have a great day.